Hi everyone, I'm Ohanya Doc. In this video, I'm going to discuss about allergic rhinitis. If you like this video and benefit from it, hit the like button, share, comment below, and most important, subscribe. What is allergic rhinitis? Allergic rhinitis is the inflammation of the mucous membrane that line the nose. It is due to overreaction of the immune system to an allergen. What is an allergen? An allergen is a harmless substance that is capable of producing an immune allergic reaction. An allergen, when your body recognizes an allergen as a harmful substance, that's when an allergic reaction occurs. What are the common types of allergen? One, we have pollen grains. Pollen grains are produced when plants are flowering. Two, we have dust. Dust can be an allergen that can cause allergic rhinitis, especially when you are cleaning the house or sweeping. Three, we have dust mites. Dust mites are microscopic insects that feed on the dead skin cells. Dust mites are found in your pillows, your beddings, your mattress, and furnitures around the house. Four, we have Anibodanda. Anibodanda is produced by pets and all warm-blooded animals. Anibodanda is like a human dandruffs on the human skin. Anibodanda contains proteins that come from dead skin cells of an animal, the saliva of the animal, and also other body fluids of those pets. These will produce what we call an allergic reaction because they are allergens. Number 5, we have cockroaches. Cockroaches, especially in urban setups, are so many, so they can trigger an allergic reaction or allergic rhinitis. Then we have rodents. Place which is highly infested with rodents can trigger those allergic rhinitis. And also we have perfumes and strong smells like paints. All of them are allergens. How does an allergen cause allergic rhinitis? When you breathe air that contains allergen will land on the mucous membrane that lines your nose. Your mucous membrane contain immune system cells. These immune system cells will mistake this allergen as a harmful substance. Immune system cells will respond by producing IgE antibodies. These IgE antibodies will signal your immune system to produce chemicals like prostaglandins, leukotrienes, histamines, and other inflammatory mediators. These chemicals will be released into your bloodstream by your immune system cells. The effects and actions of these immune system cells is what will produce your signs and symptoms. Signs and symptoms of allergic rhinitis include: one, we have rhinorrhea. Rhinorrhea is the excessive production of watery mucus. Two, we'll have a postnasal drip. Postnasal drip is when that excessive mucus will be trying to drain down into your throat, causing you to cough. Three, we have nasal congestion. Four, we have loss of sense of smell. Five, we have sneezing. Six, we have itching. You will have itching around your nose or inside your nose, itching around the eyes, itching around the roof of your mouth, and also itching inside your ears. You will also have redness of the eyes. Your eyes will also be watery or will have excessive tearing. Your eyes will also be swollen, and you will also feel a lot of itchiness around the eyes. Your ears will be stuffed, and also you will experience itchiness inside the ears, and also you might experience ear pain. You might also experience signs like headache, fatigue, and malaise. What are the factors that increase the risk of having allergic rhinitis? One is genetics. Allergic rhinitis is strongly related to your genetics. If you have a blood relative, such as your parent or your sibling who has allergies, you might also have allergic rhinitis. Two, if you have other allergies, people who have allergic rhinitis have a tendency to develop other conditions like nasal polyps. We have asthma and also allergic dermatitis. Allergic dermatitis is the allergy of the skin. How do we diagnose allergic rhinitis? Allergic rhinitis is diagnosed when your doctor will ask you questions about your personal medical history, about your family medical history. Your doctor will also ask you about the signs and symptoms you have. Your doctor will also examine you around the nose, around the throat. Your doctor might also perform laboratory tests that try to investigate the allergic rhinitis. How is allergic rhinitis treated? The best treatment for allergic rhinitis include avoiding the allergen the specific allergen that cause you to develop allergic reaction or allergic rhinitis. If it is difficult to avoid these allergen, you can also have other medical approaches like one, prescription medications. There are so many prescription medications that relieve the symptoms and treat allergic rhinitis. We have other alternative therapies. Three, we have supplements that treat allergic rhinitis. What are the complications of allergic rhinitis when not treated? One, you might develop sinusitis, acute or chronic sinusitis. Sinusitis is the inflammation of the sinuses. Two, we have sleep disturbances. When your nose is stuffed and also is congested, this might interfere with your sleep. And also, we have complications like otitis media. Otitis media is the problem of the middle ear. The middle ear is that part of the ear that is beyond the eardrum. You might also develop eustachian tube problems. Eustachian tube is a tube that connects your throat and to your middle ear. You might also develop palate problems. Palate is the roof of your mouth. You might also develop dental problems. Dental problems, that is overbite. Overbite happens when someone is using their mouth to breathe. And last, you might also have a poor quality of life. Symptoms like fatigue and malaise, and also most of the time you are buying those medications. These will cause poor quality of life. Allergic rhinitis can be seasonal or perennial. Seasonal means that your signs and symptoms occur during certain periods of the year, especially when plants are flowering. We also have patients who have perennial allergic rhinitis. Perennial allergic rhinitis is when your signs and symptoms of allergic rhinitis occur throughout the year. These might be contributed by the place that you are working. If you are working in an environment that is exposing you to these allergens, you might have a perennial allergic rhinitis. I'm Wahinya the doc. Follow and subscribe to watch more content like this. Thank you.